Cavitations are basically residual infections in the jawbone which result from extraction of teeth. If the extraction site is not meticulously curetted and cleansed, the bacteria just infiltrate into that wound and live there for the rest of the life of the patient.
Every bone in your body is connected to another bone by way of a ligament. Your tooth is connected to your jawbone by way of what we call a periodontal ligament.
If a tooth is properly pulled, when the tooth is out, the dentist will also take out that ligament. And if that ligament is gone, that bone will heal in so that there is full bone and you have a restored jawbone. But if the doctor pulls that tooth and doesn't take out that ligament, that space where that tooth was may seal over on the top and be a cavity.
So that periodontal ligament staying in the socket, it prevents communication from the body being able to send the osteoblasts and the osteoclasts to that extraction site and fill in with healthy bone. It becomes a barrier.
And it will be a place where the body then will use as a storage depot for junk, toxic junk, bacteria, funguses, and it won't hurt. It may not be completely visible on a regular x-ray, but it is sitting there.
So the periodontal ligament prevents healing. One actual study on the 5,000 cavitations left after wisdom teeth were removed, 4,999 had not healed. Only 1 in 5,000 had healed.
The majority of people in the United States and in the developed countries around the world that have had extracted teeth for any reason also have cavitations. And what's inside that hole is nothing different. And this sounds disgusting and it sounds like an exaggeration, but it's not. It's the same as wet, infectious gangrene.
These cavitations in the jawbone, they can create significant diseases, significant neurological diseases, like, for example, MS.
But that cavitation can occur from different things. For instance, a person could have a clotting disease, or they could have had a football injury, something that made the bone not be healthy in that particular area. The most common reason is that the tooth was removed and the periodontal ligament was not taken out, and therefore that void of where the tooth was never did fill in appropriately with healthy bone. The second most common reason is that that bacteria that's in a root canal tooth will find a microfracture through that particular root surface and kind of wormhole through the bone and create a void. And so it's not uncommon for a cavitation to occur next to a root canal. The most common spots are the wisdom teeth.
The wisdom teeth are unique in that there are 4 circuits going through it instead of just 2. It's heart, small intestine, and the sympathetic and parasympathetic systems. And so you see people whose adrenal glands are not working, and it's because they have infection in where their wisdom teeth were taken out, because you can have infections in the bone where your wisdom teeth were taken off for 50 years and essentially have no pain there, but it completely destroys your life. When you don't have enough adrenaline, you have trouble going to sleep, and then you have trouble dealing with stress. And then it gets to where you can't stand any stimulus. So you don't like loud music, you don't like loud noises, you can't be around a rowdy crowd, you can't be around people who are arguing. Now what I just described is a person whose life's in the toilet.
For instance, I myself had my wisdom teeth out when I was in dental school. About 30 years later, I developed a heart arrhythmia, and nothing seemed to help it. I would take intravenous vitamins, I tried homeopathics, nothing was doing it. And all of a sudden I said, wait a minute, let me check, see if I have a cavitation. That wisdom tooth, which is on the heart meridian, you see, was causing the problem.
If you can get a good normal 3D cone beam x-ray of your jawbone, then you do have a much higher reassurance that you don't have this cavitation process going on inside the jawbone as well.
And if the dentist unroofs that and scoops that stuff out and then removes that ligament and then that heals, that patient can get well.